We're here at the Lord Mayor's parlour in Belfast City Hall, and the Lord Mayor, Nicola Mallon, has kindly hosted a reception to recognise and celebrate the Supporting People programme, not just in Belfast but across Northern Ireland. We know that 26,000 people annually are helped by SP, whether that's frail elderly people, people who are experiencing homeless, people with a range of disabilities. And I suppose the unifying theme of the programme is that it's helping to enable these 26,000 people to live with as much independence and dignity as possible in the community. Associations are involved in a wide variety of ways. Obviously, we're landlords, so a lot of the sheltered housing schemes, supported living schemes are owned and run by housing associations. But we also provide a lot of the actual housing support, so a lot of those services that help people to live independently, sustain their tenancies. We're delivering those directly, but also we work with a wide range of partners, whether that's the health and social care trusts or managing partners, so charities like the Simon Community, First Housing, DePaul Ireland, all these sorts of charities are working in partnership with housing associations to provide that joined up housing and support to enable people to live independently. Well, I think there are two really powerful statistics that have emerged from this research. It was commissioned by NIFHA and it's been carried out by Citra, who are a specialist supported housing charity in England, and a consultant called Phil Saunders. And they took a methodology that was developed by the international consulting firm Capgemini. And the two key figures that stand out are that for every £1 invested in supporting people services in Northern Ireland, that generates net financial benefits of £1.90 for the Northern Ireland Executive. So we can see that supporting people is a preventative programme, it's an invest to save programme, and overall that means that supporting people is saving the public purse in Northern Ireland £125 million each and every year, which is a phenomenal saving. And some of the figures, for example, the savings for housing support services for older people suggest that for every £1 invested in that preventative housing support for older people, £2.60 are saved. So in the context where we're having more and more pressure on hospital beds and acute services, we really need to recognise that for the transforming your care vision to be fulfilled of people living with appropriate care and support in the community, we need to invest, yes, in domiciliary and personal care, but equally importantly in that housing support that enables people to live independently and sustain their accommodation in the community. Helping people to live in the community is the right thing, that it's cost effective, that actually it does generate the net financial savings, but it does require proper, it's not free. You do actually have to ensure that you're continuing to invest in that preventative service in the community, and that if you continue to do that in the right way, the savings will accrue and you will actually shift left and help people to live in the community for longer. So I think we know that there are huge sort of quality of life benefits for 26,000 people. That is a serious justification for investing £70 million a year in the programme. But when we know that it's saving so much more in net financial benefits, I think we have to ensure that we continue to invest to save through the Supporting People programme.